Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out the small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental improvements to achieve their moonshot. And today, I'm delighted to be joined by Tom Kottler. He's the CEO of HealthPrize Technologies, a company that's looking to provide an incentive program around drug adherence and medications. Tom, thanks for joining me today.
My pleasure. Thanks for having me.
So just to set things off a little bit, it would be helpful if you could share with the listeners a little bit of your background, how you arrived at this point in your career, specifically around HealthPrize.
I've been a healthcare entrepreneur for 20 years. This is my fourth healthcare startup in that period of time. I've done a healthcare IT company, 2 medical device companies, and then HealthPrize, which I founded sort of by mistake. I was actually looking to start another company and poking around for ideas, and through a friend of mine, met a gentleman named James Jorash, who is one of the founders of Priceline, who works at a place called Walker Digital. You may know a guy named Jay Walker. He's a pretty well-known entrepreneur, started Priceline and some other companies. James is his head of inventing and was leaving Walker Digital with some patents in hand around the idea of using things they knew about consumer marketing and consumer psychology to motivate patients to stay on therapy. And at the time, I did not know that medication non-adherence was this huge healthcare problem. But James educated me and shared with me these patents, and I got super excited about it. About 9 years ago, James, a former neurosurgeon named Dr. Katrina Furlick, and I started HealthPrize with the idea of focusing on the problem not as a problem of principally cost and or forgetfulness, which it really is not, but truly a problem of human psychology, of consumer marketing. And that's where we focused and focused on selling our platform, which is a software as a service platform that uses ideas from gamification, behavioral economics, and loyalty marketing to motivate patients to get educated about and stay on prescribed therapy.
So it's interesting. I think what I pick up in there that I find really intriguing is that the key, or one of the key learning points, is that reframing of the problem. So, as a physician, I can tell you the first time I discovered the take-up rate of the prescriptions that I was writing was kind of mind-blowing, because it sits at this sort of 50% level, or maybe even less. And then, as you go down the tail of, people fill it, but then don't even take it.
Yeah.
The feedback mechanism around this that says, I prescribed this, oh my goodness, it didn't work. But wait, 1 in 2 people might not have taken it. How the hell have we been managing medicine without that adherence? And yet that's been the state of play for years, right?
So it's a shocking problem. So let me throw some concepts and some statistics at you. So what we hear, like there was a big WHO report, World Health Organization report out a few years ago, about 10 now actually, that threw out that 50% number, but it doesn't really mean very much. Let me give you some ideas and concepts and numbers that may mean a little bit more for you and your audience. Non-adherence is really 3 separate kinds of problems. The first problem is called primary non-adherence. And you said you're a doctor and you write scripts for patients and are surprised to find the low adherence rates. Well, depending on the indication, anywhere from 15 to 35% of patients never fill their first script for a medication. This is called primary non-adherence. And to give you a stunning and somewhat shocking statistic for primary non-adherence, patients discharged from the hospital after having a heart attack, 30% of them never fill their CV medication. 30%. So as I like to say, they've seen the white light at the end of the tunnel, and this does not scare them enough to actually go and fill a prescription for their medication. My guess is if you track them, greater than 30% of them probably go to buy a cheeseburger and fries when they leave the hospital, as opposed to go get the medication and a salad. But yeah, the primary non-adherence numbers are just enormous. The second problem is called the 90-day cliff. That is, within the first 90 days of taking a prescribed medication, depending on that medication, somewhere between 25 and 60% of those patients unilaterally go off therapy. This could be for any number of reasons. They don't like taking pills, it's too expensive, or they don't like paying for it, actually. It's not that it's too expensive, it's they choose not to pay for it. They may have a side effect. They may not get a perceived benefit. There are a host of reasons why patients might go off. So what you have in the United States is that anywhere between 40 and 70% of patients, after only 90 days, are no longer taking a medication to treat a chronic condition. I am not talking about a 10-day Z-Pak to treat an infection. I'm talking about drugs to treat diabetes, hypertension, high cholesterol, you name it. Whether it's a primary care or specialty care condition, patients are off of therapy. And then the biggest drop-off actually is what's called secondary non-adherence. That is patients who go off therapy between day 91 and day 720. So in the first 2 years of therapy, patients who just, for whatever reason, stop taking their medication. I can give you some shocking statistics that I think frame this issue pretty well. Patients brand new to injection therapy for diabetes, after 6 months, only 16% are still adherent to medication. After 6 months, less than 10% are filling their prescription on time. In a more serious condition, not that diabetes is not serious, but medication non-adherence, so not taking their immunosuppressants, is actually the primary reason that patients reject transplanted organs. So this is a problem not just in primary care conditions with middle-aged guys like ourselves who think they're still invincible, who don't take their statin. It's a problem in cancer, in transplant, in glaucoma. So patients blind in one eye are less than 60% adherent to putting drops in the eye they can still see from. So it is a huge problem that we have typically looked at through the simplistic lenses of cost and forgetfulness, except it really isn't either. Now, that is not to say that people don't have a problem paying for their medications. Many people do. And it's not to say that people don't forget to take a medication every once in a while. They do. But the biggest problem in medication non-adherence is not taking your meds every once in a while. It's not refilling your prescription over time. That's a choice people make. So if I have a heart attack and I leave the hospital and don't fill my CV medication, I didn't forget. I chose not to fill it. And likewise with cost, it's really not a cost problem as much as a value perception problem. Many people who complain about the cost of their copays pay $100 a month for their cell phone bill and $200 a month for cable television and cash to the vet to take care of their family pet, but they choose not to pay for their medication because we feel like it's something we shouldn't have to pay for. But interestingly enough, if you look at the Netherlands, for example, where there are no copays and for some reason lots of adherence researchers, in the Netherlands where patients pay nothing out of pocket for their medications, they have virtually the same rates of non-adherence as we do in the US across major primary care conditions. So it's really not a cost or forgetfulness problem. It's a problem of value perception in human psychology.
That's just completely I knew it was bad. You just made life a whole lot worse from my perspective. And, I know there are people that dig into this. Well, that's all right. But this is important. It's such a fundamental issue because it's part of the loop of we diagnose, we treat, and treatment, more often than not consists of pharmacological agents. And if the rates are that high, it doesn't matter what we think is effective or not. We're not really understanding just based on what people are taking. So we're not really delivering good care. So this leads to the obvious question, and I'm really excited to understand. So you've taken a whole concept of what I see as gaming. So you threw out some statistics, and I wanted to throw out some because for the perspective of this, gamification, I think is confusing term for some people, but essentially using the drivers that people who live and play these games. And for a sense of that, this is a $31 billion market. I went to the Gamers Developers Conference for the first time ever this year and was blown away by, the attention and so forth. And the money that's there, just World of Warcraft is pulling in 5 million in subscriptions on a daily basis. So there's people engaged, but they're getting nothing for it. Nothing in terms of I'm not making money, I'm actually paying money. And here you are taking a concept and trying to apply this. So help us understand a little bit about the thought process and the technology behind Health Prize.
Yeah, so let's level set a little bit on gaming versus gamification. So we do not create games per se.
Right.
There are companies quite successfully employing actual games for the purpose of engaging patients. And interestingly enough, there are digital therapeutics companies using games to actually achieve outcomes in the absence of a therapeutic, and getting 510K approvals in the United States and even outside the United States, getting governmental approvals to write prescriptions for games for patients. That is not what we do.
Sure.
And the difference between gaming, which is an actual game, and gamification is that gamification is the application of gaming mechanics to everyday experiences to make them more interesting, exciting, and engaging. That's what we do.
Yep.
And so I'll give you some examples of gamification outside of healthcare. There are companies like Facebook and LinkedIn that use them beautifully. Let me give you a simple example maybe the audience can get a hold of to understand this idea. You know that email that LinkedIn sends to you that says how many people have viewed it's got blue circle, number in it that says this many people have viewed your profile of the last week, and whether it's higher or lower percentage-wise than last week.
Right.
That is not a game, but that's gamification.
Absolutely.
That's competition, status.
Yep.
It's using all of those ideas of why people want to play games in a real world experience to get you to engage with LinkedIn. And the open and click-through rates for that email are enormous. That's just an example of gamification. So that's what we do. We build these ideas of gaming mechanics, of the ideas of leveling and competition, status, achievement, all of these things that are the reasons people want to play games into our real world experiences for pharmaceutical brands, which are who we sell to make them more interesting so people will engage with our platform. The purpose of our engagement, and you hear the term patient engagement all the time, our view of patient engagement in terms of medication adherence is that the reason people don't take their medication is because they lack the medical literacy or education to understand its value and therefore have a lower value perception of their medication, and often have fear associated with it. So for example, if I'm a patient new to injection therapy, I'm a diabetic, let's say, to stick with the example I gave earlier, I probably took metformin, and I took metformin and another pill, and my disease progresses, and now I've got to start injecting myself. That's a scary thought. I mean, I would be frightened by the notion of it. And so in order to get people to understand the value of their medication, to understand how to use their drug delivery device if the drug is injected or inhaled by the patient, you need to engage them consistently over time. And that's why we use these ideas from gamification, loyalty marketing, which provides them with actual incentives for engagement, and behavioral economics to try to get them to engage consistently, frequently over time, like other digital engagement tools like Facebook do, because that's how you get people to be educated and to learn. And that's what we do. We offer them weekly quizzes, weekly surveys, a thing we call the daily fortune cookie, competitions, leaderboards, all kinds of things they can engage with, that are interesting and fun, because that's what people want to do. They don't want to engage with their illness. They want to engage with something that's interesting and fun. And at the same time, we slip in lots and lots of education, but done in a fun and interesting way that allows people through short bits of information over and over again, like a consumer packaged goods marketer would do, so that they can ingest the information, digest that information, and then act on it by taking a positive healthcare action.
So for those of you just joining, I'm Dr. Nick, the Incrementalist, and today I'm talking to Tom Kottler, the CEO of HealthPrize Technologies. We were just talking about the difference between gaming and gamification, and essentially gamification takes those principles that drives those millions of people that are in these games and uses that, and you're using it for medication adherence. So tell us a little bit about the journey to this. So you met some individuals that had some background in this. You've obviously created a tool set that you're now applying and offering up. Tell us how that works. What's the experience and how's that going at the moment?
So it's very interesting. So medication non-adherence has historically been this problem that people have identified and understood to be a significant problem. And let me just lay some statistics out for you. It is the 6th leading cause of death in the United States. It is responsible, medication non-adherence, for an estimated 290 billion with a B, of quote unquote otherwise avoidable medical expenses annually in the United States, according to the New England Healthcare Institute, making it more expensive than the cost to treat cancer or diabetes. It is responsible for somewhere between 20 and 25% of all emergency room and senior care facility admissions. It is, according to a report we did with Capgemini, responsible for $637 billion of annual revenue loss to the pharmaceutical industry. It is the cause of, actually, at the most important element of this, a tremendous amount of unnecessary human suffering. And I'll give you a quick example. One of my early investors invested in the company because his sister lost her husband to a brain aneurysm and found out that about a year before he had his brain aneurysm, he stopped taking his hypertension medication, which his doctors believe was the cause of his demise. And I cannot tell you the number of people I have met since I started this company, friends, family, at conferences, investors, all kinds of people who have a non-adherent story, either themselves or a loved one, but no one is unaffected by this eminently and easily avoided problem. So it is a huge societal issue, not just an economics issue for both for every major constituency in healthcare.
So I understand that. What is it that HealthPrize is doing to address that?
So, as I said earlier, we look at it as a problem of human psychology. And so in order to engage patients to change their habits around their medication taking, we engage them through gamification, behavioral economics, and loyalty marketing. Our average, we've had over 1 million people engage with our platform. Our average user logs in almost 5 times and spends almost 40 minutes a month on the platform. So to give you a sense of that, that's more than twice the amount of time an average active user spends on LinkedIn. It's a lot of time we spend with people to educate them around how to take their medication, why they should take their medication, increasing their medical literacy, and generally being a cheerleader for them as they go through the daily decision they have to make about whether I'm taking my medication today, whether I'm refilling my script on time, those kinds of daily decisions. And I think this is really critical, and something we really forget is that people on chronic medication to treat chronic conditions have to make daily decisions about their medication, and we're there to support them virtually on a daily basis. And this is really the difference between what was available 10 years ago and what's available today is the ubiquity of internet-connected devices in our world that allow us to communicate with people, connect with them, prompt them, be there for them when they're making these decisions every single day.
So you talked about tying up with the pharma companies, and that's how you're sort of pushing this out. What's the process? Help me understand this from an individual's perspective. How does this work for if I wanted to engage with HealthPrize, if I was so driven, and maybe it's not me, or maybe it's the physician who says I want to, how is that working? How do you get people into this platform? How's that sort of process working?
So we typically sell our platform to life science companies and build a branded experience on our platform for the specific brand. We've done work in 17 different indications to date: hypertension, high cholesterol, asthma, COPD, HIV/AIDS, hemophilia. We're actually hoping to build our first program in oncology soon. We were to cross a variety of conditions between those that are life-threatening and those that are just quality of life, all of which matter to patients. We typically drive patients to enroll through existing physician or patient touch points the pharmaceutical brand might have. So that could be when they're signing up for a copay card, whether they're going to the brand.com website. We're developing our own patient enrollment network through retail pharmacy and population health partners to expand our ability to offer these programs to more patients. But there is a tremendous need to support patients in their journey with their medication. And so we're developing tentacles to reach out to them at much larger scale. We've run programs with tens of thousands of patients in them and hundreds of patients in them. Our goal is to run programs with hundreds of thousands of patients in each program to get to more patients, to allow them to get the great benefits that these medications provide to them. I myself have been on prescribed medications for years. I'm a middle-aged guy, so I'm on atorvastatin. And for a long time, actually, I was non-adherent and understand the psychology behind it as lame, frankly, as it is for many people. I just was a middle-aged guy who thought I was still indestructible, even though I personally have a family history of heart trouble. And it took, frankly, a long time for me to figure out the value of this medication and to make the causal connection between my staying on therapy and my biomarker, my blood chemistry being at an acceptable level to reduce my risk of dying of a heart attack like my father did. So I understand the psychology behind it. But I have to say it is weak psychology. It is kind of something we really need to get over. Because, frankly, these medications can save a lot of lives if taken consistently.
So just in terms of closing thoughts, as you think about this moving forward, what would you say is the sort of overarching learning point that you've had as you've marched down this new organization that uses gamification to try and improve this adherence problem? Was there anything that jumped out at you that you said, wow, that really was very striking? It was a learning point, aside from obviously all the terrifying statistics.
How much major healthcare constituencies, life science companies, payers, pharmacies, providers talk about adherence and how little they actually do about it and how little they understand it has been eye-opening for us. It is a huge problem. There have been over 60,000 peer-reviewed articles written in the last 40 years on this problem, and yet there's been a lot of talk, but not nearly as much action as there should be.
Fantastic. Well, as usual, we've run out of time, unfortunately. It just remains for me to thank you, Tom Kottler, the CEO of HealthPrize. Really appreciate the discussion. Very excited to see the genesis of this organization trying to address this astoundingly large problem that's been almost hidden, I would say, for many years. So thanks for joining me, Tom. I appreciate it.
No, thanks, Dr. Nick. I enjoyed it.
Thanks for joining me today. Do you have any better ideas, or have you found a small incremental change that's brought about a big improvement in your world? Let's continue the conversation on our hashtag, The Incrementalist, or share with me at DrNick1 on Twitter. You can find more information about the show on our program page at HealthcareNOW.radio.com. And tune in next time to hear my discussions with leaders and innovators from around the globe who've revolutionized their space by using small incremental improvements to achieve their moonshot. I'm Dr. Nick, the Incrementalist, and I'm starting a revolution through evolution.